So I'm here with Dr. Nadine Ritter, and today we're going to talk a little bit about her expertise in analytical sciences in biologics. So Nadine, my question to you is, what is the most challenging analytical assay?
Well, I think that people who are experts in the technologies would say, theirs, but looking over the palette of tools that we have for biological products, one of the ones, or there's two of them that cut across every biological product, but one of the ones that's significantly analytically challenging and unfortunately very misunderstood in the field are for residual host cell proteins. Every biological product that's coming from an expression system, which is kind of the definition of a biological product, your purification team is trying to enrich downstream the molecule that you want and remove the molecules that you don't want, but that the cell needed to make the thing that you do want. And inevitably, you can't get rid of every single piece of residual host cell protein or host cell nucleic acids. And so the DNA assay has got some features to it that make it a bit more amenable to being more platform-like, if you will, because it's a genome. But the host cell protein assay is the cell's proteome. And that's a function of cell conditions, of cell stock, of a lot of things, of age of the cells, of apoptosis level of the cells in the culture. So there's a lot of variables that lead to a potential 1,000 or more analytes, which could come downstream and which we've seen already in case studies that slight changes in the upstream or downstream conditions can lead to a shifted population that appears in the drug substance. So the consistency of that mixture of proteomic proteins is the challenge for analytical assays. And it's further a challenge because they may be below the limit of detection of our methods, but they're not below the limit of detections of our body. Our body is exquisitely sensitive to foreign proteins. We've evolved that way on purpose. And so we've got multiple challenges here. We've got, something which is potentially problematic to the patient. We've also seen publications where some host cell proteins are problematic to the product. There are things which can exacerbate degradation pathways that if they're residual in the product, they don't necessarily cause biological problems in people, but they can certainly change your product quality attributes over time. And so the assessment of host cell proteins, we've had some amazing advances in the last decade or more, including tools like 2D Dij, including tools like mass spectrometry, in addition to the classic tools we've had, which is immunoassays. And each one of those has its own strength, it has its own weaknesses, has its own limitation. And my concern is that in the field, there's a lot of misinformation. We've had lots of wonderful advances like commercially available HCP ELISAs, which actually filled a tremendous unmet need that we had in the industry. I mean, before you got to your process-specific HCP assay, you were blind. That filled a hole. But we've gotten so far so fast, and there's so much misinformation about quantitative techniques and what you see and don't see. That's the most challenging. So I really encourage people to pay attention to their HCP characterization and control strategy, because the tools are very powerful when they're used correctly.
Brilliant. Thank you, Nadine. And then my next question is, what would be your second most challenging analytical assay?
So I would think that the second most challenging one would be functional assays, potency assays, particularly potency assays that are required to, when we have a statutory requirement that biological products must demonstrate a certain amount of activity, potency, for their quality attributes. Because it's a difference between an egg that can become a chicken and an egg that's fried. So I could have the same egg, but it's not going to do what it's supposed to do if I fry it. So we need to have functional assessment of our biological products. And many of them, not all of them, but many of them are based on a relative potency assay, which requires an established, calibrated, stable batch or batches of the reference product, of the product itself as a reference for the potency assay. And it is extremely challenging to develop and establish a reference standard when it's the first one ever. That literally becomes the chicken and egg scenario, right? And so there's better and worse strategies at the beginning, But the thing that I see people not recognizing when they set up their CMC program is that they don't realize that decisions they make and data they generate on their very first potency reference standard ever at the beginning of their clinical experience, those decisions and those data sets will live with them all the way through development, all the way through commercialization. Because and how do you go from one reference to another? That's challenging for potency. For physical assays, that's not hard to do, but for potency assays, it's very challenging. And then the assays themselves can be challenging, although we've made some huge strides in the last decade or more with better controlled critical reagents, even to some cases ready to use cells. So they're not as bad as the assays themselves are not as challenging as they used to be, so long as we operate them in a state of control. The biggest challenge is the control and characterization and stability of the relative potency reference standard for the product.
Okay, thank you, Nadine. And it sounds like both these assays are difficult and challenging. So where can people find information to learn about this, regulations, guidances, and so on?
Yeah, unfortunately, in biologics, we have had from the beginning of recombinance, at least, we've had guidance documents that say that thou shalt have a host cell protein assay to monitor host cell proteins, and thou shalt have reference standards that you can measure potency, relative potency with, but it doesn't really go into much granularity. None of them go into much granularity about actually how to do it. There have been some industry meetings. It's probably pretty obvious. I've been associated with one of the organizations, CAS, for a very long time. We've had some CMC forums on HCPs and on potency assays and on reference standards for potency assays. But those are case studies, and they're very interesting and important, and they provide some best practices. But there's not a lot in official guidance, which I think also contributes to the misunderstanding or the confusion or the poor decisions that are made in CMC strategy. Of course, since I'm talking to you, I could say, come to a class and I will share everything I know about these with you. But it truly is something where it's an accumulation of various bits and pieces. And we don't really have a very clear, consistent, comprehensive set of regulatory guidance documents drilling down into either of those subjects.
Thanks for that answer, Nadine. And thank you very much for speaking with us today. Thank you very much.
Great. Thank you very much.